In the world of elite sports, such as the Olympics, the line between victory and controversy is often razor thin. Now, in today's video, we will take a dive into the murky waters of therapeutic use exemptions, or TUEs, and their potential misuse in the world of competitive swimming. So what is TUEs? A TUE, or therapeutic use exemptions, allows athletes with legitimate medical conditions to use otherwise banned substances. For many athletes, especially those with asthma, these exemptions are vital for their participation. Now, asthma is a condition that affects the airways in the lungs, making it harder to breathe. Now, people with asthma have sensitive airways that can become inflamed and narrow when triggered by allergens, cold air, or exercise. Now, this leads to symptoms like wheezing, coughing, shortness of breath, and a tight feeling in the chest. Now, asthma can vary from mild to severe, and while it can't be cured, it can be managed with medications that help keep the airways open and reduce inflammation. Now, all asthma patients are prescribed with a rescue inhaler containing a medication called albuterol. Now, it works by relaxing the muscles around the airway, improving airflow and oxygen intake. Now, while this is crucial for asthmatic athletes, albuterol is in a class of drugs called beta-2 agonists that stimulate beta-2 receptors. Now, as an inhaler, albuterol has a limited effect on the airway, but when used at a high dose, it also affects the whole body, having the potential to enhance endurance, reduce fatigue, or even promote muscle growth. Now, this dual effect has placed American swimmers who used albuterol under TUEs in the spotlight, as some argue that even at permitted doses, the drug could provide an unfair advantage. In recent years, several American swimmers have come under scrutiny for their use of asthma medication under TUEs. Now, while these athletes insist their use is purely for medical reasons, critics argue that even permitted doses could provide a performance edge, sparking a heated debate within the swimming community. Michael Phelps, the most decorated Olympian of all time, has been open about his use of asthma medications under therapeutic use exemptions throughout his career. These TUEs allowed him legally use medications like albuterol, which are otherwise banned substances, to manage his asthma. Phelps and other athletes with similar conditions' use of TUEs has sparked debate over whether such medications could inevitably enhance performance, as albuterol can improve breathing efficiency and potentially aid endurance. Now, Phelps has consistently advocated for fair play in sports and has been vocal about his concerns regarding doping, particularly in the context of the 2024 Olympics. He testified before a U.S. House panel, emphasizing that if doping is not properly addressed, it could threaten the integrity of the Olympic Games. Now, his remarks came in the wake of a major doping scandal involving Chinese swimmers, some of whom had previously tested positive for performance-enhancing drugs but were still allowed to compete. Now, Phelps argued that stricter sanctions, including lifetime bans for those caught doping, to maintain a level playing field. Now, in 2021, 23 Chinese swimmers were found to have used performance-enhancing drugs. Despite this, 11 of these athletes competed in Paris, winning multiple medals. Now, Fei Li Wei, a prominent Chinese swimmer who competed in the 400-meter freestyle at the 2024 Summer Olympics, despite being one of the athletes involved in the 2021 doping allegations. That the scandal not only raised questions about their victories, but also ignited a diplomatic row, with China firmly defending its athletes. That the controversies surrounding both American and Chinese swimmers highlight a growing concern. Are TUE's and lenient doping regulations undermining the integrity of the Olympics? As we compare these cases, it's clear that the pressure to win can lead to questionable practices, and the line between treatment and enhancement becomes blurred. These incidents force us to consider the effectiveness of anti-doping measures. While WADA and other organizations work tirelessly to ensure fair play, the potential for misuse of TUEs remains a challenge. Can the current system prevent abuse? Or is it time for stricter regulations? Now, could some unknown new performance-enhancing drugs evade detection? Now, there is a saying, we don't know what we don't know, and only time will tell. Thank you very much for watching, and let me know what you think of the topic. Don't forget to like, share, and subscribe for more in-depth analysis of medical controversies. Take good care. Bye.